Welcome back to the Minds and Memoirs podcast.
I am Jake Maynard, a third-year student at the University of Texas at Austin studying business with interests in behavioral economics and mental health.
And I'm Jordy Bach, a rising senior at WashU in St. Louis, studying psychology, neuroscience, philosophy, and computer science with an interest in mental health like Jake. And this is episode 2 about the signs and symptoms of mental health. Like the last episode, I'm going to start off by reading 3 more anonymous stories about people's experiences with the signs of their mental health.
Then we'll hear a story from a mental health advocate from Curtin University in Perth, Australia, and end the discussion with an expert, Dr. Brownson from the University of Texas. So what do we mean by the signs of mental health? A sign of mental health is any signal or symptom that arises because of your mental health. We're using the term sign because they are essentially indicators of what's going on with your mental health currently. Some signs are specific to certain mental disorders, while some signs are a general indication that your mental health is suffering in some form or another.
Some examples of signs: they can be both positive or negative. Signs that you have positive mental health are if you're feeling confident, feeling like yourself, you're setting goals for yourself, and feeling optimistic about the future. Some more negative signs are pretty varied. One example of a common sign of depression is having unusually low energy and motivation. Another example, a persistent feeling of dread over a long period of time is a common sign of general anxiety disorder. Other common negative signs are poor concentration when working or in school. And then some more uncommon signs might be quick to aggression or having a short temper, feeling extremely socially withdrawn and isolated, and in extreme cases, hallucinations or delusions.
So why are we talking about this? The signs of your mental health, it's an important indicator of what's going on in your mind, in your body, your physiology, and your mental state. It's, symptoms and signs can really connect to the impacts in your life and the actual disorders that you may or may not have. So it's important to understand, how to, connect the signs of mental health to, in terms of what you're experiencing, to your inner reality and external reality.
Now we'd like to dive into some memoirs we found online that highlight the various signs of mental health qualms and conditions.
The first one, posted on the Beyond Blue forums, someone asked the question, are they depressed? Taking a step back, they realize their mental condition is being affected greatly from so many different angles. There's so much going on that they don't even know where to begin. Social anxiety caused failed job interviews, feeling misled by the education system that lacked proper preparation for the career they were aspiring for, arrival to a new country, no friends, and experiencing loss. Feeling tired. Where to start? How to start? A messed up sleep pattern and restlessness that hinders action. Extreme self-criticism. Debilitating mental breakdowns when thinking about the reality that they live in and the distance from the reality that they want to live. These feelings can't be put into words. All that is known to them is the 3 words, I am lost.
So in this story, there's a lot of signs and symptoms here, like an awareness of social anxiety through countless unsuccessful job interviews, mental breakdowns and panic attacks, feeling overwhelmed with life circumstances, sleep insomnia and restlessness, fatigue throughout the days, a lack of motivation to do things even as basic as daily chores, and feeling like the life that they want to live is impossible to reach. And also struggling to put these feelings into words and struggling to understand what these feelings mean.
So there's a long amount of symptoms here, a long list of symptoms or signs that this person felt. And it's important to try to answer their question. The title of the forum post is, am I depressed, or are they depressed? So I'm going to ask Jordy the question right now. Jordy, what do we think? And not as medical professionals, of course, but as a general take, do they show signs, maybe symptoms of depression? What are your thoughts on that?
If we compare the signs that they expressed during this story to some of the common signs of depression, like having mental breakdowns and feeling overwhelmed, having trouble sleeping, fatigue through the days, a lack of motivation, all these things are pretty common signs of depression.
Yeah, I think there's a chance. Depression affects how people think, feel, and act. It makes it more difficult to manage from day to day, and interferes with study, work, and relationships. And oftentimes it is prolonged, so it's usually longer than a few weeks, oftentimes months, even years. It's important to note that everyone experiences some of these symptoms from time to time, and it may not necessarily mean a person is depressed. But equally, not every person who is experiencing depression will have all of these symptoms. So some of the behavioral symptoms of depression may include withdrawal from friends and family, stop going out and going to social environments, stop doing their usual enjoyable activities, not getting things done at work or feeling motivation to do those things, even relying on alcohol. Those are some of the behavioral symptoms. Physical symptoms may include being tired or being sick and run down, headaches, muscle pains, sleep problems, a change of appetite or a loss of appetite, and sometimes significant weight loss or gain. So they have the potential to have depression, but it also, everyone can experience these things at one point in time. So it's important to note that.
This next anonymous forum post, also from beyondblue.org, is titled Spiraling, and this time we'll be reading it word for word.
So they write, I don't really know how to explain how I'm feeling. The best way to describe it was in a stream of consciousness thing I did. I hate being stuck in my head. Someone once explained to me that it felt like a spiral. At first, you think nothing of it. The spiral is large and loose, but when you start to think more about it, the tighter it becomes until it's around your neck, strangling every emotion out of you. It is dangerous for me to think like this because once I am in it, it is impossible to climb my way out. I tend to fixate on one single word or one single sentence and become utterly obsessed with the ideas behind it. I dance, and it had been a good 2 months out of competing in my state when a girl told me about my rival. I was on a plane trip back from an interstate competition in which I did win, but I felt as if I didn't dance well. He is looking strong, she notified me. I didn't feel strong. I didn't feel as if I danced well. What does strong mean? Physically strong? Technique? Is he better than me? He is, isn't he? Thousands of thoughts were buzzing through my head, and I honestly couldn't think, grasp, or even decipher a single one of them. And I just felt exhausted by the time I arrived home. Then it all went away when I beat him at the next competition. By a lot. I had wasted all of my energy on something I didn't even need to be worried about. So basically, what I am asking is there a way I can stop obsessing over small and possibly insignificant ideas? Are there any ways to get out of the spiral once I'm in it?
So some of the recurring themes here are not knowing how to explain what you're feeling and not understanding the thoughts and emotions going through your head, overthinking and worrying to the point of anxiety and restlessness.
There are also some new themes that we can see here, and that would include, the downward spiral, a negative feedback loop that doesn't seem to ever stop, and also obsession, which is similar to overthinking, but obsessing in specific on words, thoughts, or things. These are things and signs that we can take note of to think about, in ourselves. The final story is an anonymous blog post from Massachusetts, med.com, titled Success Story, a personal story of mental illness.
This story begins when the anonymous author began their residency program after successfully finishing med school. Throughout school, they were steady and high achieving, but 6 weeks into residency, they suddenly couldn't complete work or arrive places on time, moved and worked at a very slow pace, and struggled to concentrate even on simple tasks. They felt mentally paralyzed, unable to break through a disorganized, confused state. Even their memory was challenged. They said, "Having always been blessed with an excellent memory, I noted with dismay that I was often unable to recall basic facts I had read." So what was wrong? They had no idea and sought a medical diagnosis, believing it was some sort of physical disease, even hoping it was some sort of physical disease that would explain what was happening in their life. Instead, the diagnosis was depression. This didn't come as much relief, though. It was an isolating experience, and this person felt that it wasn't an adequate justification for their work shortcomings compared to how a physical disease like migraines or a tumor would have justified their failures and struggles. But they were able to seek help through medication and psychotherapy and found a support network to help get them through the ails of depression.
To kick off our discussion on this story, we'd like to identify a new theme that emerges: the hidden damage of depression. Others do not understand the author's struggles with depression and do not sympathize as they would for a physical disease or ailment. This leads to isolation, frustration, and feeling like their struggles with depression are not valid. Note the debilitating effect of depression. They weren't just sad. They struggled to function. Memory, concentration, and mental efficiency were really impacted as well. These are the signs that don't fit the commonly known definition of depression. And as a callback to the last episode, some impacts of mental health on their life were the isolation they faced and the decrease in work productivity. It's good to take note of these things when you think about depression in the broader scope, as it can impact your life and be significant in ways that are even sometimes uncommon and aren't already on the defined line that is depression. Moving on to our first guest conversation. As mentioned before, our first guest is Taysa Watts, a Master of Professional Psychology student at Curtin University in Australia. She has been an advocate for mental health awareness in her community and has experienced the challenges presented by mental health herself. Welcome, Taysa, to the Minds and Memoirs podcast. We're excited to hear about your experience, insights, and understanding of mental health. And to kick things off, tell us a little bit about yourself and your personal experience with mental health.
Thanks for having me here, Jake. So my name is Taysa. I live all the way in Australia, in Perth, Western Australia. And I am 22 years old. I'm currently still at uni. I'm doing my master's in psychology. And I, um, am half Indonesian and half Australian. So I actually immigrated to Australia when I was 6 years old, after being born in Indonesia and having like all my family over there, my mum over there. But yeah, we moved over to Australia when I was 6 and have been here ever since. Yeah, so I guess in terms of me, and I guess my mental health journey, obviously immigrating from Indonesia over to Australia was a really big move. I was quite young, so I don't remember too much of it. But my mental health journey, I would probably say, probably started before I was even born, in that when my father passed away, unfortunately, 3 weeks before I was born, my mum suffered. and experienced, I should say, a lot of different mental health challenges. So she had postnatal depression, and she also struggles with bipolar disorder. So that was kind of growing up. I sort of like witnessed, I guess, her own struggles, but her own experience of her mental health journey. And having seen her and watch her go through that um, is wildly, I don't know, it's kind of wildly different to how I experienced it. As I experienced obviously different mental health, mental health disorders than her. But when I got to 14, 15, so around high school years, I was diagnosed with major depressive disorder and generalized anxiety disorder. I was diagnosed with depression when I was 14, and anxiety probably about a year or so later. But I think my psychologist was saying that it probably was a co occurring thing. They just sort of like, we will focus so much on my depression that that was sort of the first thing that we tried to target in treatment. But I remember when I um, sort of first started feeling off and not too great in my mental health, I was so afraid of telling anyone, especially my mum, because cultural wise as well, like it's a big thing to talk about mental health in Indonesian culture, and my mum being very religious, like it wasn't something that was super talked about. So when I was 14, I tried to sort of seek my own help in a way, in that sense, because I wanted to stop feeling the way that I was feeling, but I also didn't want my mum to know. So over here in Australia, they have a free mental health service for teens and for young people that you can actually go to without having parental consent once you're 14. So I went to it. It's called Headspace. Went to Headspace, and the psychologist told me that because how I was rating and the things that they had assessed in me were probably too severe for them to treat. So I got moved to like a private sort of like practice, and yeah, they linked me up with a psychologist who was really good. And eventually, I did tell my mum, which was a really big step for me, specifically around when I got closer to probably 15, was around the time I told my mum about what I had been going through. And I remember my like initial scares and thought processes around sort of like telling her. That was the biggest thing. Like I never had an issue with talking about mental health and talking to people who I didn't know, but when it's people that you care about and you love, and someone who might not necessarily be as accepting, it was definitely very scary. So it was good to finally get that sort of, I guess, like overcome that fear by actually talking to her about it. My psychologist helped me lots. She was really good, and she managed to help me get through high school. And actually, more than that, like she helped me flourish in high school, which meant that I could go to uni. And I actually decided to study psychology, um, partly because of the things I'd experienced, but I also noticed that my psychologist made such a big difference to me that I kind of wanted to sort of pay it forward. So that's sort of how I am where I am now. So despite the struggles and the difficulties, it's kind of been almost a blessing in a way because it's led me to my career and my life career, hopefully. So yeah, that's where we are
Oh
now.
yeah, that's great. That's cool that it led you to the to something you're interested in,
Yeah,
and
100%. Yep.
hopefully you're pursuing. That's a great outcome from all of it.
Mm, yeah.
So So how did you know? This is an interesting question that I would like to ask. It's
Mm-hmm.
centered around, how do you know this the when the signs you're experiencing, or how do you know they're caused by mental health problems and not just like everyday ups and downs? Like what was it for you that kind of gave it away,
Mm.
that you thought there was something deeper there than just like, the everyday ups and downs that come with life?
Yeah, yeah. For me, it was definitely like I had always been an anxious kid, like ever since I was young.
Mm-hmm.
But when it started getting really bad, it was sort of affecting my life, like my functioning in life. For example, like with my depression, I didn't want to go to school. I didn't want to like see my friends. I didn't want to like do the things that I loved. Like I loved singing a lot. And arts was something that I was really passionate about growing up. When I was in primary school, I used to like every chance I got, like at every assembly, I would be singing on stage or, doing some sort of performance or playing the baritone or whatever, like whatever artsy thing it was, I would be doing it. And then I went to high school and I don't know why, but I think just the change or maybe the transition into high school was like really big. I was dealing with a lot of family stuff at the time as well. So it was like, I guess, compounded by all the life stress factors. Um, but my depression like got really bad to the point where like no one understood why I didn't want to go to school. And especially my mum didn't understand that. She just sort of like thought I was being lazy or being like a normal teenager who doesn't want to go. But I had always been like, I had always loved going to school. I'd always loved being outgoing and bubbly and, like I was anxious, but I almost like the anxiety wasn't me. And the depression wasn't me. There were like characteristics maybe that, I like there were things that I dealt with, but characteristically I was an outgoing, bubbly person. So my personality was vastly different to the things that I was experiencing in the mental illness space because, depression makes you withdraw and makes you not want to do anything. Whereas I was always like, I want to go do this and I want to do that. And I always had my hands in too many baskets because I always wanted to make sure I wasn't missing out on things because I wanted to experience life. So once I started, going and withdrawing and just not living my life to the fullest and not wanting to, for example, like do the things I love, like going on stage and singing and all that sort of stuff. I think that's when I realized like I'm not me. I'm not being who I usually would be. I'm not loving the things that I usually would love. And that was the scariest thing for me because having my dad die so like pass away so young. He was 39 and obviously I wasn't even born when he passed away. One of the things I've always lived by is like to live your life to the fullest, and I just felt like the depression had weighed me down so much that I didn't want to get out of bed and I didn't want to do anything. And the anxiety as well was horrible. Like I had gotten into my high school on like a gifted and talented sort of program thing. That's what they call it here in Australia. I'm not being up myself. It's what it's called. Um, so it's called gifted and talented program here in Australia, and you basically like apply and you get given a spot in a high school that does whatever. And for my high school it was arts, and I really really loved performing arts, and that's what I got into school for. But when year 9, year 10 hit, which is when my mental health was really sort of going downhill, and when I started realizing I didn't want to perform anymore. So the thing I had got into high school for and the thing that I kind of was known for in a way, I was all of a sudden like, no, I can't do this. I had just this incredible, like, very soul crushing anxiety. And performing in front of like hundreds of people is anxiety provoking for anyone. But for me, it's what I used to love. And all of a sudden, I couldn't do that. But not only just that, I couldn't even get out of bed. because I was so anxious about what was going to happen during the day. So yeah, I realized because I wasn't being myself. I think that's sort of what it comes down to. Like, I've always been quite a self-aware person, even as a young kid. Um, and all of a sudden, I was not me,
Right.
which
Right.
sucks.
Yeah. Yeah. Totally.
Yeah.
I get that. That's actually I feel like a lot of people could probably relate to that if they have
Mm,
experienced or are experiencing mental health concerns of any kind. That's
mm,
probably one of the things that people notice the most when they're going through those
mm,
things is that they feel significantly different for almost no reason,
mm.
right? It's like,
Yeah.
well, like there can be reason, but sometimes it's like, you know,
Yeah.
last year, a few years ago, I was not
Mm,
this way, and now I am,
yeah.
and it's
Yeah.
hard to explain, I'm sure.
Yeah, especially when you're, like, a vastly different person. Like,
Mm-hmm.
for me, I'm such a bubbly and, like, sociable person, so when I started not being that, I was like, "Oh, this is a red flag, like, there's clearly something going on here."
Right.
But I
Right.
almost didn't wanna admit to myself that it was mental health related because of all the, I guess,
Mm-hmm.
like, stigma that comes with mental health in everyday life, but specifically for me, it was about culture. Like, in my culture,
Mm-hmm.
there was so much stigma around it that the person that I should feel sort of the most comfortable telling it to, I couldn't.
Mm-hmm.
So that was a big, big, like, barrier for me in a sense. But yeah, I'm glad it kind of, like, despite how horrible it was,
Mm-hmm.
and there are still elements of it that I still live with, like, today and moving forward into my future, I'm sure I will. But it has led me sort of to where I am now,
Yeah.
which is, I guess, is a good thing.
Yeah. I mean,
But yeah.
yeah, I think so. In terms of the context of, your signs and your symptoms, how did understanding
Mm,
those of your mental health, your signs and your symptoms, how did understanding that
mm,
help you manage your mental health concerns?
mm. So big one, obviously was my depression, so, like, not wanting to get out of bed. But or something that my psychologist actually said to me that I still remember to this day is, like, motivation does not always, like, happen before actually doing something. So you might not have the motivation to get out of bed, but that doesn't mean it won't come by you getting out of bed. It's almost like the behavior actually encourages that motivation in a way. So I hated it when she told me this when I was, 14, because I was a teenager and very, like, angsty and like, "Why would you tell me this?" But she used to say, "Just get out of bed. Like, just try it. See how you feel afterwards." Like, you don't have to feel motivated. No one's telling you how to feel about, the situation or how you're feeling, but just get out of bed. Even if it is just to, go to the post box. If you don't wanna go to school yet, that's fine. But it's something that I hold to this day. Even when I'm doing assignments at uni, I'm like, I don't have to be motivated to do this assignment. I just have to do it. And maybe the motivation will come afterwards, but at least I would have still gotten something done. So that really resonated with me. But the other one was, like, with my anxiety, because I was having a lot of panic attacks when I was, in high school. That was sort of one of the things that was also making me not want to go to school because I didn't want to be known as, like, that girl who was, like, having panic attacks and had to leave the classroom. So after, I noticed all these things were happening and I went to go get help, my psychologist actually really got me into meditation, which again, at first I was like, no way, you cannot get me to sit there and listen to meditation for like 20, 30 minutes. It's not going to work. It's not going to do anything. But what I found was actually it did work. It was just about finding the right sort of like the right meditation audio track for me to use, and once I found sort of like the type of meditation that I like doing, my school was really good about it. They sort of like let me have half an hour every day, whenever I wanted. Like if I wanted it sort of like during recess or lunch or like during a class, if I felt like I was going to have a panic attack, they would just make some room for me in the office and for me to do that for half an hour, which ended up honestly like just that support. And because my psychologist also was supporting me and sending like letters to the school being like, she needs to do this, like it will help her anxiety in the long term, it actually really helped me to get the most out of my education and not miss out on it. So yeah, once I realized that I was having panic attacks, and getting help for it, also with the depression and getting help for it, I was able to come up with a plan with a professional that actually knows what they're talking about and what they're doing and can help me. Which yeah.
Right. Yeah, no, that I think meditation is really interesting,
Mm,
and it comes in many
yeah.
forms, right? It comes in all the different audio
Yeah,
tracks,
yeah.
and even exercise, or
Mm,
things like yoga.
yeah.
I think those are all forms and variations of
Mm,
meditation. Even if it's kind of disguised,
yeah.
as people don't think of yoga as meditation, but in a lot of ways it's very similar.
Mm,
So at least certain types.
yeah.
But yeah, I think going on to our next question, what's the most significant way your mental health impacted, or your mental health issues impacted your life?
Mm, yeah. Ooh, the most significant way. I think I would be inclined to say probably my relationships with others. So like even though I managed to sort of get help for my mental health, I think it's not something that you sort of just get rid of. Mental health is one of those things. It's sort of like you can learn to manage it and you can learn ways of coping and getting better, but it's not going to completely be rid of. Like I still, you know, every couple years I might have a relapse for like a month or so of depression. And that's something that I'm always going to have to keep in the back of my mind. But I guess the thing with yeah. How do I best explain the impacts that it's had on my life? Because it's had a profound impact on my life. But specifically I would say my relationships is the thing that it's had the most impact on. Obviously being that my mental health, I had to go tell my mum, and that itself was a massive impact on our relationship. Not because she kind of understood after like explained it to her and all that sort of stuff, but just I know that the relationship had changed. So it's almost like that how people view you and how people see you once you've told them that you have a mental illness or you've had one in the past, but you're not currently living, like you're not currently having an episode at the moment.
So, what is a sign or two that your mental health is
Mhm.
doing well?
Right. So for me, it's definitely being able to go and do the things that I love doing. So right now, that would be like hanging out with my friends, playing volleyball, um, just like everyday things, like actually being able to do them as well. So it's not just the things I love, but just being able to live my life and being able to go to uni, being able to see clients and actually be in a good headspace while seeing them. Um, and almost like, I think the biggest one would, yeah, definitely be I feel like myself and I feel like me and I feel at peace and content. I think that's probably the biggest sign that I feel like I'm doing well. I don't have a need to sort of like change how I'm feeling or withdraw from everything in my life, which is something that I notice when I am not mentally well. But when I am mentally well, I feel like I just could take on life and everything that has to offer me, which is a great feeling.
Yeah, I think what you said, like, just feeling like yourself is
Mm,
a great sign that you're doing well in terms of your mental
yeah,
health, and that
yeah.
you're in a good state. So Yeah, I completely agree. Like that makes a lot of sense.
Mm.
So, thank you for sharing your story and your
No
insights. I believe
worries.
it's extremely important that people share these experiences,
Mm.
really to fight the stigma associated
Yeah.
with mental health, and to kind of push push us all forward into
Mm.
talking about mental health and really opening up so that other people can too.
Yeah.
So yeah, we really appreciate your time and your courage to come on and talk to us.
No worries. Thank you so much for having me, Jake.
So that was a really nice conversation. And some takeaways. She noticed the things she used to love doing, she didn't want to do anymore and had kind of lost some passion for. Also, she found that going to get help doesn't always mean you have to tell the people close to you right away. It's okay if you're not comfortable talking about it yet with those around you. You can still go and find help without having to open up and be vulnerable with those around you. And finally, as a positive sign, she identified feeling like yourself as an indication of strong and positive mental health.
Next, we'd like to welcome Dr. Chris Brownson, a licensed psychologist and clinical professor, among many other titles, at the University of Texas at Austin. All right, welcome, Dr. Brownson, to the podcast. We are really happy to have you on and to discuss the various signs and symptoms of people's mental health. So thank you for coming on and speaking with us.
Yeah, my pleasure to be here with you. I'm excited to talk.
Awesome. So tell us about your expertise and area of focus within the field of mental health.
Sure. Well, I'm an associate vice president for student affairs at UT Austin, and then I direct the counseling and mental health center here. So I've spent my career really working in the college mental health field, focusing on issues related to college student well-being, suicide and suicide prevention, promoting mental health, and then working with and treating students who are coming in with mental health issues. So I've been working on that since about 2000. I've been the director here since 2005.
That's awesome. A quick question I had was, what's the most interesting research or like research topic you found yourself doing at University of Texas?
Yeah. Well, I've been involved in a lot of different research projects, but when you asked me that, Jake, the thing that immediately popped into my head was a study that we did about 10 years ago that was quite a large study that involved about 70 other college campuses that participated in the research with us. And we had tens of thousands of students participate in this survey. And one of the major findings at the time, we were really inquiring around students who have had any kind of thoughts about suicide in the past. And for those that did, wanting to better understand what they did when they recognized that that was going on. And one of our big findings at the time was the ways in which so many people conceal that they're actually feeling that way and don't talk to anybody about it. And about half the folks at that time when we did that study told nobody about it. And then when they did tell somebody about it, 2/3 of those students were telling a peer. They were telling their roommate, telling a good friend, telling a partner. And what that really led us to in the field was a recognition that we needed to really be working with college students, preparing them to know how to respond to friends who may come forward to them with information about their struggles. And so we focus a lot on that and some of the bystander intervention work that we do, where we try to make sure individuals are trained to just kind of know how to respond and how to deal with those situations when they come up with their peers.
Definitely, that makes a lot of sense. That it's maybe easier to open up to someone you're close to, like another student, as opposed to a professional or like a counselor. So yeah, it makes a lot of sense that you would focus on teaching the student population how to respond as well.
Yeah, exactly. Yeah, and I think we've spent a lot of time training residence hall assistants and faculty members and other staff on campus, which are still super important to do, but the peer part is paramount. That's where, like you said, that's where
Mm-hmm.
students are going. That's where you're going to feel most comfortable, right?
Yeah, definitely. So our next question: what are some significant leading indicators of anxiety, depression, and or suicidal thoughts in college students?
Yeah, yeah, great question. Well, it really depends, and it can show up differently in different folks. But in general, thinking about depression or thinking about suicide, perhaps. Some of the things that I'd be looking for are ways that somebody may be expressing a sense of hopelessness, um, any sort of changes in terms of like a loss of interest in activities that somebody used to be involved in. That could be a sign of increasing depression. Sometimes individuals might be really tired, and fatigued more so than normal. Sleeping a lot or changes in sleep, sleep disruption in general, changes in appetite. Those would all be some signs that depression might be going on for somebody. Um, when we're looking more at suicide, certainly one of the things that we want to do is always take seriously when somebody talks to us about things like, wishing that they weren't here anymore, just wish this was dead, wish I was dead. And that's a tough one, I think, sometimes, because that's entered into sort of like the common vernacular, right? You're having a bad day and you're like, man, today it'd just be a better day to not be around, or making comments like that. And so, a lot of times they're benign and mean nothing, right? We're just blowing off steam and just expressing to someone that we've had a cruddy day today. But we always train people to follow up on that, and to say, hey, I know I've had crappy days like that too. And I just want to check when you say that, you don't want to be here anymore. Like, are you really thinking about, hurting yourself, or thinking about suicide in some way? Or are you just, you're just blowing off steam? And they say, oh no, I'm just blowing off steam. Or they might say, no, I have been thinking about that. And what you've done by checking in on that is you've opened the door up a little bit on having that conversation. And by saying that, you've indicated to that person that you're actually open to that conversation, because it's hard, right, to talk about something like that. And going back to what we were just talking about in terms of half of people not telling anybody, I think it's the shame of that, the embarrassment that you'd really be thinking that way. And I think a lot of people would want to talk about it, but just don't know that they really can, or who to talk about to. So that's something we're often training people on. Other, just to kind of finish out around some of the things related to possible indicators of suicide. Certainly, big changes in behavior, you want to look out for. If you're noticing that somebody is really isolating a lot, signs of helplessness, depression, anxiety, withdrawing from activities. So, those are the kinds of things that I think I'd pay attention to.
Yeah, absolutely. Those are all very important indicators to keep an eye out for, and just recognize, even in yourself. If you're ever slipping down the slippery slope that is mental health, and even if it's just anxiety, right? You can start to identify some of those things yourself to hopefully reel yourself back in. So I think those are all important things. But another thing that's important that is talked about sometimes is academic success within relation to someone's mental health. So my question is, how can academic success measure one's mental health? Are there patterns that indicate certain mental health concerns, or I'm sure the answer is it depends, but speak on that for a second.
Yeah. I mean, one of the, so in my job, working at a college counseling center, academics is always on people's minds, and some students actually come in to seek counseling because of academic concerns, and that is the reason that they're presenting for service. That's not the norm. I think most of the time people are coming in because of anxiety that they're feeling, and the impact that that's having in their life, for depression, for issues around, traumatic experiences that might have happened. But we do get students who come in, wanting to really talk about the academic struggles that they're having. And in all of those other examples that I gave, those have impacts on your academics. So mental health and academics are really closely tied. And that's why, most colleges and universities have, college counseling centers and have other resources that are invested in college students' mental health, because we understand that in order for a student to be successful academically, they've got to be well. And so we provide health services, and we provide, counseling support and education around how to take care of yourself, because if those things are falling off, you're not going to be showing up in the way that you can to get the best out of your education. And that's what we're all about here. So it's a really close link between those two things.
Yeah, that's interesting. And I think University of Texas has an interesting policy with the amount of credits that you can take for a semester. And if you want to take more than, I think it's like 18 credits, you have to get a mental health check in order to enroll in more than 18 credits for a semester. So I think that's a really interesting policy that I don't know if I've seen that, because I went to a previous university before UT, and I don't know if they had that there. So I think that's a really interesting kind of administrative decision around mental health.
Well, and what you're talking about is really the ways in which an entity, in this case, an institution of higher education, thinks about what many of us refer to as the constructed environment, and the way we construct our environments to either support or not support, mental health and well-being of the people in that environment. And I think about things like everything being open 24 hours a day, 7 days a week. The libraries, for example. We do that for convenience for students, so they have a place to study and it's safe. But then the other side of that is, are we also saying, hey, studying at 3 a.m. is like, you should be doing that, And it's like, whoa, I don't know about that. Sleep's important, sleep's important too. In my class that I teach for master's students, one of the things that I do that I think annoys them is that I don't make my assignments due at midnight on that day. I make them do it at 8 p.m. or 7 p.m. And that's my subtle or not so subtle way of saying, I don't want you to have to stay up to midnight for my class. Now they push back and they say, well, we're staying up that late anyway. If we're not going to do it in your class, we're just going to do it in someone else's class. But, I'm wanting to convey to them that these other factors of sleep and taking care of yourself are important too. So there's mental health. I think when people think about mental health, they think about counseling, they think about psychiatrists, they think about medicine. But there's so much more that we can do in the environments that we create for ourselves that impact, mental health and well-being in ways that are really important. So yeah, there's a lots of examples of that.
Yeah, definitely. I mean, I think school in general is a stressful environment to be a part of, especially like universities. And there's a lot of pressure on students, and it can get overwhelming really easily. And so, yeah, like that's an interesting concept of like shaping your like daily life and your environment to kind of ease that pressure on yourself.
Yeah, for sure.
And I know you kind of mentioned like the blowing off steam versus actually being having really negative thoughts. But more generally, how can you know if something is a sign or a symptom of mental health versus just a part of your daily ups and downs in life?
That's a great question. Yeah, because a lot of them can look the same at times. If we've all had nights where we can't sleep. We all experience anxiety. Before we do something unfamiliar, or you're giving a speech to a large group, or right, like these things are just really normal to feel that. So none of these things in and of themselves necessarily indicate that there's a mental health issue. But I think one thing is the totality of taking all these things together. If many of them are co-occurring at the same time. I think another thing is the impact that it's having on one's life and functioning. So if these things are going on in a short period of time, but somebody is still functioning just fine, their relationships are going well, their work is going fine, their mood in general is okay, they're succeeding academically. Those are signs that these are temporary things, and that they're fleeting because they're not having as much of a significant impact in terms of the way somebody's actually functioning. On the other side of that, if these things that we've talked about are really getting in the way of somebody meeting their own personal goals, having effective relationships, being around other people, being healthy, thriving at work, thriving at school, that's an indicator that it's kind of going down more a road of a mental health issue versus just a regular up and down. And then I'd say another thing is how long it's lasting. I think being sad, being anxious, those are normal parts of just being a person. And something happens in your life, and you lose an important relationship, or break up with a partner, you failing a class, you're having conflict with your family. Those are going to happen to all of us at one time or another. And we're going to respond to that with emotions. And we're going to be sad. It's going to increase our anxiety. We're going to have trouble sleeping because we're distracted. But typically those diminish, right? Time kind of goes on, and those things let up. I don't consider that a mental illness by any stretch. That's just being a human. But if those things don't go away, right, they're getting better instead of worse day after day. You're having to find other ways of coping, like using drugs and alcohol in a way that's much more than sort of normal, or what would be healthy. If you're doing other things that maybe are not in your best interest, or the healthiest things to be doing, and finding that you're coping in these maladaptive ways, I think that's another indicator that this is kind of moving into a space that needs some attention.
Right. And I think you mentioned a little bit like what, part of when it's not, something serious, and it's just kind of a part of the ups and downs of life, you have some things that you can point to, like, you're doing well academically, like you're in a good routine still, maybe like the things that you can point to say, okay, it's not as serious, it's just more in the moment. On that topic, what are some of the other positive signs of good mental health?
Yeah. Well, and I'll answer that, but let me go back to one thing I said too, and just say that just because though these things maybe are going to be more fleeting, or they're going to improve with time, doesn't mean though that there's not things that we can also do for ourselves that will help them. So even if it is just kind of a normal part of coping in everyday life, the kinds of things we might be able to do to help that, such as talking with a friend about what's on our mind, or making sure that we're getting enough sleep and exercising, taking time for yourself and carving out some time for your own sort of pleasure and well-being. I mean, those are important things to do, regardless of whether it's kind of going down the road of sort of a mental health issue or not. In some ways, the distinction between those two can be important. And then in other ways, some of the things we may do to respond may look really, really similar. But what you're talking about and asking, Jake, is about thriving. Like, what does it look like to
Exactly,
thrive?
right,
When everything's hitting and things are going well. And I think that's back to your academic success question around students. I think it's you're engaged with your classes and your learning. Your relationships are positive and fulfilling. You feel like you're making progress toward the goals that you have, and kind of the person that that you want to be, that you're enjoy you're experiencing a sense of enjoyment and satisfaction. I mean, I think those are signs of thriving. And it's important to note that you can thrive and have a mental illness. There are lots of people who have depression, who have bipolar disorder, who have anxiety, who live lives that are thriving lives. They have to manage those things, and they think about them, and they do things to help with those symptoms, just like you would with any other kind of illness. And you can still be happy and have engaging relationships and be doing well academically. So that's a really important thing to know, that a mental illness does not mean the lack of thriving or the lack of having good mental health. It just means that there's some things that you have to do in addition to cope and to keep those symptoms in check as best you can, while also really kind of living your best life.
Right, absolutely. I think that's a good distinction to point out. That makes a lot of sense. All right, I think that wraps up the questions. Jordy, do you have any follow-up questions you wanted to ask before we end it?
No, I think that's it.
Great. All right. Well, that was great. So let me just end it. Thank you, Dr. Brownson, for answering our questions and taking the time out of your day to share with us the expertise. There's a lot of valuable information said here, and I think understanding these indicators and signs of mental illness, mental health in general, whether it be good or bad, and understanding all the different little nuances that we talked about here, I think it's all extremely important, and it can be really helpful for people. And so we hope the listeners get some good value out of this. And so thank you again for coming on the podcast. We really appreciate it.
Well, thanks, Jake and Jordy. Appreciate the invitation and what y'all are doing to raise awareness about these important issues. So yeah, best of luck in your podcast.
In this episode of the Minds and Memoirs podcast, we discussed the different signs of mental health and how to identify the signs in ourselves and in others around us. We spoke with Taysa Watts and heard her story about mental health. And we spoke with Dr. Brownson from the University of Texas at Austin to discover more about the signs of mental health.
In the next episode, we'll look into the threats to our mental health, like what aspects of our environment, our relationships, and our social expectations present challenges to our mental health. Then we'll talk to new guests about such threats and what they mean for our mental well-being.
Once again, this is the Minds and Memoirs podcast. Check out our website, mindsandmemoirs.com, for more information.